What's up, guys? Dr. Eric Giver with 417 Sports Medicine Orthopedics. Today, I want to talk about a topic that a lot of people do not understand and a lot of people don't even know. And that's the fact that a hospital charges 3 to 4 times as much as an outpatient imaging center or a private practice with an MRI machine. And I'm going to tell you why. So, let's talk about the first thing, facility fees. So hospitals are, well, let's face it, they're kind of a necessary evil. We all need hospitals from time to time, whether we have an emergency or whether somebody needs a surgery or they need to be, taken care of in a hospital. But they charge higher fees than you would in an outpatient setting. And these are called facility fees. So if you were to get a test done, such as an MRI, at a hospital, they're going to charge 3 to 4 times as much as you would if you got it done at an outpatient imaging center or say a private practice that has an MRI. In the grand scheme of things, hospitals, again, they have to charge higher fees because they're making up for other things that they lose revenue on, and they're making up for the infrastructure they have to have. But ultimately, that responsibility ends up falling on you, which is not necessary because you can find an independent imaging center or a private practice with their own MRI and get things done at a fraction of the price. So let's talk about a real example. So for instance, let's say you injured your knee and you ended up going through the hospital and you ended up having an MRI done at the hospital. That MRI is going to cost you anywhere from say $1,500 to $3,000 or $4,000 when it's performed at the hospital. And that's based on facility fees and the fee of the MRI. They charge a higher price. Let's take that same MRI, the same injury, the same literally a knee MRI, and you're going to get it done at an outpatient imaging center or a private practice for anywhere between, say, $500 and $800. Why? It's the exact same image. It's the exact same MRI quality. It's the exact same process, except for one has a facility fee. So once again, hospitals aren't all bad. Obviously, we need them in a lot of different instances, except for outpatient services. They're charging a hospital fee when you could be just being charged a regular outpatient clinic fee or an outpatient imaging fee. So you got to think about these things before you just go and have your MRI done at a hospital because you're paying too much. In this day and age, it's pretty rare to have great health insurance. People have fairly high deductible plans, so we're talking anywhere from $1,500 to $10,000 as your deductible. That means that everything you do until you hit that deductible comes out of your pocket. So you're spending an incredibly large amount of money on your insurance premium. Then you've got to meet your deductible. Well, guess what? If you're going through the hospital and you're going to spend upwards of $3,000 and $4,000 on an MRI, that's all coming out of your pocket. So why not? Let's drive down the cost of healthcare. Let's get it done at an outpatient imaging center or perhaps a clinic like mine with an MRI and drive that cost of healthcare back down where it should be. So unfortunately, most of the doctors these days are owned by the hospital or are employed by the hospital. That means that it's easy for them to just say, hey, I'm going to order an MRI and send it straight to the hospital. But unfortunately, that's not for your benefit. That's for the hospital's benefit because they're going to make money on that study, lots of money. If you just stop and ask and say, hey, could I do this at an outpatient imaging center? I hear it's much cheaper. They can very easily send the order somewhere else, whether that be an outpatient imaging center or somebody like me, where we can do the MRI at a fraction of the cost and help put the money back in your pocket. It's processes like these that actually have been documented by medical journals and studies that when hospitals buy out outpatient clinics or outpatient imaging centers, the cost of healthcare goes up. That price of that MRI, that price of that heart scan or that test goes up because the hospital is now charging facility fees. So places like CMS, which is in charge of Medicare and Medicaid, they're trying to push back and say, hey, let's make it either even pricing, or let's actually give the people that are in an outpatient imaging center or an independent clinic practice more money to try to push those studies back to the areas without the facility fees. Again, there's a lot of back and forth between politicians and the healthcare industry and hospitals and insurers. But ultimately, right now, the way it is, you're paying a lot more if you go through the hospital. So don't hesitate. Ask the simple question. When they say, hey, I need an MRI, you say, could I do this at an outpatient imaging center? Can I get it done cheaper? And you could save thousands of dollars on your MRI study. So again, we have an MRI. It's in our office. If you'd like to either come see us or inquire about, hey, how do I get my imaging done here? Give us a call anytime. We'd be happy to talk you through it. Sometimes it's as simple as, yep, we can just scan you today. We're willing to go through those steps with you, and we'd love to get your MRI done at a much more affordable price. See you soon.